Bacterial diseases in fish. Subject aquaculture. Paper fisheries health management, extension and marketing. Topic: Bacterial diseases in fish. Outcomes: students will be able to identify common bacterial diseases in fish. Students will be able to use different methods for diagnosing bacterial infections in fish. Students will be able to apply best practices for minimizing the risk of bacterial infections in fish. Students will be able to evaluate the effectiveness of different treatments for bacterial infections in fish. Objectives: identify common bacterial diseases that affect fish and describe their symptoms and causes. Gains knowledge in controlling bacterial infections in fish populations. Discuss various methods used to diagnose bacterial infections in fish. Analyze the different treatment options for bacterial infections in fish, including antibiotics, probiotics, and vaccines. Introduction: Bacterial diseases are significant problem in aquaculture industry and can cause severe economic losses. Fish bacterial diseases are caused by a wide range of pathogenic bacteria, including Aeromonas, Vibrio, Pseudomonas, Streptococcus, etc. These bacteria can infect fish in various ways, including through wounds, ingestion, or exposure to contaminated water. Columnaris or reddish block disease. Columnaris is caused by Chondrococcus columnaris. Chondrococcus columnaris. This disease is usually associated with low oxygen levels in the water. Initial symptoms are appearance of grayish patches on the body. These patches spread and become sores. The sores ooze blood. The gills are destroyed. Treatment includes addition of 1 ppm copper sulfate in the pond effectively to control this disease. Tetramycin can be administered orally through food at the rate of 3 milligrams per 100 grams of body weight of the fish. You can see the sores on the body. The gills, you can see the gills are damaged. Furunculosis. This disease is caused by Aeromonas salmonicidae species. Fishes living in dirty waters containing large amounts of decaying matter gets this disease. The symptoms are boils on the skin, pus-filled skin sores, bloody fins, blood discharge from the lesions, septicemia. Septicemia means bacteria enter into the bloodstream, kidney necrosis, etc. Fishes die in large numbers. Infected fishes should be removed and kept separately in the initial stages of the infection. Dipping the fish in 0.5% copper sulfate or potassium permanganate for 2 minutes will be useful. Antibiotics like chloromycetin, tetracycline, tetramycin are most effective at a dose of 5 mg per 100 grams of fish body weight. You can see the furunculosis infected fish with sores. The sores are deep and they ooze pus and blood. Epizootic ulcerative syndrome. Epizootic ulcerative syndrome. Epizootic ulcerative syndrome has caused severe damage to India's aquaculture. EUS is caused by pathogen Aphanomyces invadens. This syndrome has been found to affect a variety of fish species like carps, catfishes, mullets, etc. The symptoms are pea-sized hemorrhagic spots all over the body, which ultimately turn into big ulcers of the size of coin with central necrotic area. You can see here the pea-sized sores they become bigger into a coin size and cause become necrotic and form sores. Fish start rotating while still alive and eventually die. The internal organs like liver, kidney show hemorrhages. Till date, many methods were tried to control this disease. Sulfonamides were found to be effective to control this disease. Infected fishes should be separated and should be euthanized to prevent further spread of this disease. Fin or tail rot disease. You can see how the tail or fins they rot, they simply disintegrate and wither away. This disease is caused by Aeromonas liquefans, Aeromonas liquefans bacteria. Fin and tail rot is associated with poor sanitary conditions in ponds. In this disease, the fin rays become brittle first, later break leading to complete destruction of the fins. The infection may also spread to body surface. In the initial stages of infection, bathing the infected fishes in 0.5% copper sulfate solution for 2 minutes will cure the disease. In the advanced stages, bath in a solution containing chloromycetin at 60 milligrams per liter for 6 days is known to be effective cure for this disease. Dropsy. Dropsy is caused by Pseudomonas punctata. Pseudomonas punctata. It is characterized by yellow-colored fluid inside the body cavity. You can see in the body cavity there accumulation of fluid takes place. The scales and eyes protrude, they bulge, they swell. The intestines, liver, kidney become swollen. This is a fatal disease in culture systems. Infected fishes can be cured by giving 2 minutes 0.5% potassium permanganate dip bath. Potassium permanganate dip bath. Streptomycin, oxytetracycline antibiotics give good results. Prevention measures such as maintaining good water quality, providing proper nutrition, and practicing good hygiene are essential. Bacterial gill disease (BGD). Bacterial gill disease is most commonly caused by Flavobacterium. Flavobacterium. The symptoms of this disease include pale, inflamed, swollen gills. This you can see here the inflamed gills, swollen, inflamed gills can be seen there. Loss of appetite, increase in mucus on the gills and head. Transmission occurs horizontally through the water from fish to fish. Environmental quality should be maintained by avoiding overcrowding, low dissolved oxygen, suspended solids, and high ammonia levels. Treatment involves the use of antibiotics like chlorphenicol, oxytetracycline, supportive care and isolation of the infected fish. Enteric red mouth disease (ERM). Enteric red mouth disease is caused by bacterium Yersinia rookerii. Yersinia rookerii. Bacterium enters the fish body through the mouth or gills and then multiplies rapidly in the intestine, causing inflammation and tissue damage. This leads to the characteristic red discoloration of the mouth and fins. The symptoms include lethargy, loss of appetite, darkening of the skin, subcutaneous hemorrhages around the mouth and throat, and exophthalmia. You can see exophthalmia, the protrusion of bulging of the eyes, the inflammation of the mouth or throat can be seen in these diagrams. Maintaining good water quality is important to prevent this disease. Antibiotics are most common treatment for enteric red mouth disease. Tetracycline, oxytetracycline are most commonly used. Cotton mouth disease. This disease is caused by filamentous bacteria called flexibacteria. Called flexibacteria. You can see here. Main symptom of this disease is growth of white thread-like structures around the mouth. You can see in this diagram also white cotton-like structure around the mouth. This disease can be cured with antibiotics like chloramphenicol, oxytetracycline, or sulfodimethoxam. Sulfodimethoxam. Bacterial kidney disease. Bacterial kidney disease is economically important in cultured salmonids. This disease is a chronic in nature. Mortality is very high. The symptoms include loss of appetite, lethargy, weight loss, pale gills, excessive mucus production, enlarged or discolored kidneys. So you can see here the discolored kidneys, enlarged kidneys, and which is infested with the sores, internal sores. Prevention of BKD involves strict biosecurity measures such as quarantining new fish before introducing them to an existing population, properly disinfecting equipment and tanks, monitoring the health of the fish regularly. Vaccines are also available for some species of fish and can help prevent the spread of the disease. BKD can be treated with antibiotics such as erythromycin or oxytetracycline, which can be administered through medicated feed or the water. Thank you.